I would say that here in countries like UK, for example, or the Nordic countries or Scandinavian countries or in Germany, many of these countries have strict rules for the use of antibiotics. So obviously you will reduce the use of antibiotics to the prevention of the disease through vaccination because you can control the disease through vaccination, no need of more antibiotic. But in those countries, the most important part, when animals are dying of APP, you have to use antibiotics, also expensive for the veterinarian, reduction of production, and all those items are reduced by the use of a vaccine. So immediately the use of a vaccine will have a consequence of the reduced use of therapeutical antibiotics. There is no studies indicating that exactly how is affecting economically the infection, the disease is affecting economically the herds. But again, you have to think that when you have clinical cases, let's say in acute disease, you have mortality, you have the use of antibiotics, you have the use of the veterinarian, but also in chronic infection, you have a lot of lesions at the slaughterhouse where you have condemnations of the carcasses of the animals. So the impact of the disease in the farm usually is huge. In addition, acute infection goes very fast. So you can have a few animals dying now, and in a few hours, a lot of other animals also dying. So the impact is quite important. Some people are using vaccination of sows, trying to reduce the pressure of the prevalence in pigs. I would say that this approach can be taken usually after you have implemented a good vaccination protocol in pigs. This protocol is working, and then you say, okay, to reduce expenses, I will try to vaccinate sows, which is usually cheaper, and trying to improve the level of antibodies in pigs to reduce the prevalence. Two things. The vaccinations in sow should be done with the vaccine containing a bacterium, which should be the same serotype causing the disease. Why? Because these antibodies against the body of the bacteria, these maternal antibodies, once in the piglet, will reduce colonization of the piglet. So when the piglets are weaned, they will have less amount of bacteria because they have the antibodies against the body of the bacteria. If you use a vaccine which is only made by toxins in sows, these antibodies, the toxins are secreted, these antibodies against those toxins will not have any effect on the piglet colonization. So you vaccinate sows with a bacterium, antibodies against the bacteria will be absorbed by the piglets, and the piglets will reduce colonization. And after 3 weeks, when they are weaned, this piglet will have, in theory, less amount of bacteria, and it will reduce the pressure of infection. You give the first dose, then you have the second dose. The idea is to give the second dose is to boost the reaction to the vaccine. Usually, it is recommended to have 3 weeks of interval between the 2 doses. If for management problems you have no choice but to give after 2 or either after 2 or after 4 weeks after the first dose, it should not have a big influence. I mean, if you can adapt that to 3 weeks, that is probably ideal. If you have no choice between 2 and 4 weeks, it will not have a big impact. I mean, vaccination of animals during an acute infection is not very usual. And in fact, since you are treating animals during an acute infection, sometimes the treatment of strong antibiotics of these animals will eliminate bacteria, but will eliminate bacteria so well that surviving animals will not develop an immunity. And so you can have problems of 3 weeks, 2-3 weeks later, have other cases, other animals suffering infection. With vaccination, at the moment of clinical infection, animals that are not ill will develop immunity, so you can prevent this relapse of the infection 2-3 weeks later. However, it's not necessarily a good approach because you do not need to move animals to vaccination during an acute infection. You should not do that. Usually you should use a vaccine that will give enough protection that you don't need to do that during an acute infection.